G20 do to, what can the G20 do to achieve vaccine access for all? As we all know, yesterday was the formal kickoff meeting for the C20, where maybe most of you are also joining the ceremony where we meet with almost all the stakeholders also, and also our friends, Indonesian civil societies that joining us here in Bali, as well as our friends from all CSOs from the G20 countries joining from the Zoom. So civil society organizations in Indonesia who are members of the C20, especially the Working Group for Vaccine Access and Global Health, today we'll hold this side event. And this activity aims to invite the stakeholders to work together in an effort to accelerate the COVID-19 vaccination program through the Vaccine for All campaign, which will be carried out also in the C20 2022. As maybe you already read in the TOR, that the objectives of today's event is observing the opportunities and challenges of the G20 in ending global vaccine access inequality. As we all know, maybe in some of our countries, for example, in Indonesia, the COVID-19 vaccination rate is already quite high. Already, I think, reached 50% in Indonesia, especially around the Jakarta area. However, it's not the case for all countries, especially the low and middle income countries. Meanwhile, the vaccine access is one of the key for us to get out to end the pandemic, to end these war situations that already last for 2 years. So that's why we want to see the opportunities and challenges of the G20 as the forum for the most or the main countries with the most major economic in the world in ending the global vaccine access inequality. And then also we want to analyze the challenges and progress in promoting vaccines for all, including the challenges in administering vaccines for women and vulnerable groups. Especially today, if you all maybe also remember, today is the International Women's Day. So that's why I hope that this event also can bring the message how important it is to reach the gender equality. And then the third objective is to encourage the G20 countries to increase sustainable investment in public health, funding donations, and technology transfer in the health sector. And the last is we want to strengthen and consolidate and coordinate the civil society in Indonesia as well as other civil society from G20 member countries in promoting the importance of vaccines for all. That's some of the objectives for our today's event. And now we will start with the formal opening. Now I will over the Zoom time to my colleagues, Agung Prakoso, which is the coordinator of the C20 Working Group Vaccine Access and Global Health. Mas Agung, over to you.
Check. Thank you, Mbak Tatet. Good morning, good afternoon, good night from Indonesia, everyone. Selamat pagi. Thank you very much for coming to this event. And I want to say hi first to His Excellency Bapak Ronald Mujur, as one Indonesia Ministry of Health representative, Angela Tenja, Oxfam in India, People's Vaccine, and also one of our coordinator, and Lina from MSF Access Campaign, and also Ibu Lutfia Hanim, one of our Indonesia representative. Glad to see you here as our resource person, and we will learn a lot from you related to our policy pack recommendation. And we also have Bang Daniel in here, and also Rachel Ong as our coordinator also. Nice to meet you and all the participants, members of Civil 20 from around the world in Zoom meeting and also from Indonesia Jess or who attend in this room. As we know that the challenges to get out from the pandemic are still very complex. Specifically, there is inequality access to vaccine, diagnostic, and therapeutics. And the COVID-19 pandemic has made inequality in access to health even more real. Inequality of access occur in almost all aspects, including medicines, vaccine, and to diagnostic. Based our data on our words in data, Africa is the continent that has the most lagging behind in the vaccination achievement. The vaccination rate in the African continent is still below 10%, I think, from the total population. But in other hand, many countries, like developed countries, include some of G20 countries, was fully vaccinated. They can do booster until 3-4 booster. They order 4 until 5 doses vaccine to vaccinate their more than their population. And as the leader of Group of 20, Indonesia as the presidency is expected to be able to encourage equitable access to global vaccine, diagnostic, and therapeutics in the context to prevention and also treatment and containment of the COVID-19. This is also in line what C20 provide and deliver in our priority issues to expand access to vaccine, diagnostic, and therapeutics in line with priority issue from the Health Working Group G20 Indonesia 2022 to improve the post-pandemic global health governance and architecture also, especially in increasing supply of vaccine and important medical products. So this is the side event to deliver that the priority issue related to vaccine. We hope we can discuss more related to this so we can have a good and well-written policy pack that we will deliver to G20 Indonesia presidency. I think that's also for me. Thank you so much for coming to this side event and have discussed. Thank you. Over to you, Mbak Tatat.
Thank you, Mas Agung, for the opening remarks. I just remember that I haven't introduced myself. My name is Tatat. I'm from Oxfam in Indonesia, and today will be your moderator. So today already joining four resource persons. The first one is Mas Agung already mentioned, also Pak Ronald Mujur. He's the special staff of Minister of Health especially in good governance, ya Pak. Today he will representing Pak Kunta Wibawa, which is the Secretary General of the Ministry of Health, which is also in the Health Working Group of G20. And then the second resource person is Mbak Lutfia Hanim from Indonesia for Global Justice, which is also the representative of Indonesian Civil 20, the working group Vaccine Access and Global Health. Sorry, can you all please mute your speakers if you don't speak? Thank you. And then the third resource person is Ms. Angela Taneja from Oxfam India, also the representative from the People's Vaccine Alliance. And the fourth is Ms. Lena from the Médecins Sans Frontières, also representative from Third World Network and G20 AP. Now I will over to Pak Ronald Mujur as he cannot stay with us until the discussion ends. So Pak Ronald, over to you. Pak Ronald will discuss about the G20 Health Working Group priority issues, especially related to vaccine, therapeutic, and diagnostic access. Pak Ronald, please. Halo, Pak Ronald. Oh, belum ada. Oh, oke. Oke, is Pak Ronald. join us. Uh, can you please, can you please mute your microphone if you don't speak? Thank you. Okay, then we will over to Mbak Hanim first. Mbak Hanim will present about the G20 and how to ensure vaccine equality. Over to you, Mbak Hanim.
Okay. Terima kasih, selamat pagi Bapak Ibu sekalian. Ada presentasinya, Muslim? Bisa di-share? Oh ya. Oh ini? Ini untuk, bukan untuk. Saya kirim ke Zoom. Terima kasih. Saya akan berbicara dalam bahasa Indonesia. Ini adalah bulan Maret 2022. Dan ini menandai 2 tahun ketika WHO mengumumkan COVID-19 sebagai pandemik. Oke, ya.
Yeah, because we also want to hear from other participants, then we can discuss.
Udah di ini di WhatsApp.
So yeah, while waiting for the presentation to be presented, please, you who the English speaking can turn on the interpreting tools in Zoom, so you can also follow the discussion.
Udah Muslim. Oke. Ya. Jadi ini sudah 2 tahun setelah WHO mengumumkan adanya pandemik. Next. Kemudian pada bulan Mei, negara-negara maju itu berkomitmen yang disebut sebagai working together to help the world get better. Ini adalah pada bulan Mei 2020, di mana negara-negara kepala negara di G20 itu berjanji untuk merespon pandemi tersebut. Ini adalah di tahun 2020. Dan kemudian pada saat itu mereka launch atau meluncurkan yang disebut sebagai Access to COVID-19 Tools atau ACT Accelerator yang bertujuan untuk Global Cooperation Platform untuk mengakselerasi dan meningkatkan penelitian, pengembangan, akses, dan juga distribusi yang setara untuk vaksin dan banyak terapeutik diagnostik treatment. Mereka berjanji untuk bekerja bersama-sama dan di tingkat internasional. Ini adalah press release dari negara-negara anggota G20. Di sini ada presiden dari European Council, ada beberapa kepala negara dari Uni Eropa dan juga Kanada. Selanjutnya, Ini adalah yang disebut sebagai ACT yang dibuat pada 2020, 2 tahun yang lalu. Mereka akan bekerja di 4 pilar, memastikan adanya akses pada diagnostik, treatment, vaksin, dan penguatan sistem kesehatan. COVAX adalah salah satu pilar vaksin, hanya salah satu. Nah, pada tahun 2000, dalam setahun kemudian, dalam setahun kemudian mereka menyusun banyak membuat vaksin di negara-negara maju. Dalam setahun kemudian pada tahun 2021 ini yang terjadi, di mana negara-negara maju itu banyak menimbun vaksin. Di sini misalnya Uni Eropa membeli banyak vaksin lebih dari yang dibutuhkan. Jadi 5,5 dosis untuk setiap orang. Kanada 9,6 dosis. Ini pada Januari 2021. Jepang 2,3. Lalu di mana Uni Afrika di sini yang terdiri atas banyak negara ini, dia hanya memastikan 0,2 dosis untuk setiap, artinya jauh dari yang diperlukan. Sementara negara-negara maju seperti yang ini adalah negara anggota G20 banyak membeli vaksin lebih dari yang diperlukan. Di sini Indonesia baru memastikan 191 juta dosis pada bulan Januari 2021. Nah, di COVAX itu juga sebetulnya mereka menjanjikan adanya mereka bisa mengirimkan sebanyak 20% dari jumlah penduduk di negara-negara berkembang, atau sekitar, mereka menghitungnya sekitar 2 miliar dosis bisa dikirimkan pada bulan Desember tahun 2021. Nah, ini adalah pada bulan ini, pada bulan Maret tahun 2022. Ini berasal dari data dari UNICEF yang merupakan salah satu partner dari untuk delivery di COVAX. Ini adalah dari vaksin market dashboard.
Mas Muslim, sorry, next slide.
Nah, ini terlihat bahwa vaksin yang dikirimkan melalui COVAX itu sejauh ini masih 1,36 miliar dari 2 miliar yang dijanjikan pada bulan Desember. Artinya ini memang masih banyak sekali yang masih kurang. Sehingga apa yang dilakukan ini masih banyak kekurangannya, seperti yang tadi sudah disampaikan oleh Agung. Berikutnya, pada saat pandemi, ketika banyak negara-negara mengembangkan vaksin dan juga mencari obat-obatan, pada bulan Oktober tahun 2020, India dan Afrika Selatan pada bulan Oktober 2020 mereka mengusulkan yang disebut sebagai trade waiver di forum WTO. Mereka mengusulkan waiver dari provisi atau aturan-aturan di TRIPS Agreement, yaitu aturan-aturan mengenai paten, rahasia dagang, copyright, dan industrial design yang berkaitan dengan penanganan, pencegahan, dan perawatan dari COVID-19. Sampai sekarang itu sudah didukung oleh 62 negara, termasuk Indonesia. Tujuan mereka adalah mereka bisa, negara-negara tidak hanya negara-negara sponsor di sini, tetapi semua negara itu punya yang memiliki kemampuan untuk melakukan manufaktur atau local production berkaitan dengan vaksin, obat-obatan, atau APD ya, itu bisa memproduksinya secara cukup atau alat-alat kesehatan lain yang terkait dengan COVID-19, mereka bisa memiliki jumlah yang cukup untuk menangani kasus di dalam negeri masing-masing. Nah, berikutnya. Nah, setelah 2 tahun, hampir 2 tahun perundingan untuk trade waiver, ini masih berjalan, dan negara-negara maju dan Uni Eropa, termasuk negara-negara maju yang menjadi anggota G20, justru adalah penentang utama dari proposal ini. Uni Eropa telah menjanjikan komitmen sejak awal pandemi 2 tahun yang lalu, pada bulan Maret. Mereka menjanjikan banyak hal, tetapi yang terjadi adalah janji itu tidak ditepati, bahkan mereka menjadi penentang dari proposal ini. Pada bulan Maret ini juga, masih sekitar 75 negara itu masih cakupan vaksinasinya kurang dari 50%. Dan masih banyak negara juga masih di bawah 10%.
Sorry, please continue Mbak Hanim.
Ya, jadi ini setelah 2 tahun masih banyak negara-negara yang kesulitan untuk mencapai vaksinasi dosis pertama. Mungkin kita tidak melihat Indonesia karena kebetulan Indonesia sudah mencapai dosis pertama 71%. Tapi kita melihat beyond dari negara kita sendiri, masih banyak negara yang cakupan vaksinasinya itu masih sangat rendah. Nah, dalam hal ini tadi upaya untuk memperbanyak local manufacturing di banyak negara itu juga dilakukan. Misalnya dalam hal ini WHO mendukung adanya satu konsorsium Afrika Selatan untuk mengadakan yang disebut sebagai COVID mRNA Vaksin Teknologi Transfer Hub. Ini sejak bulan Juni 2021, di mana salah satunya sampai sekarang banyak negara-negara juga menginginkan adanya bisa memproduksi vaksin teknologi transfer hub ini. Selanjutnya, terakhir, lalu apa yang bisa dilakukan oleh G20? Ada banyak yang bisa dilakukan oleh G20. Di antaranya adalah mendukung trade waiver di WTO. Salah satu dari kementerian pernah menyebutkan bahwa pemerintah Indonesia telah menyampaikan ini di G20. Namun demikian, mereka negara-negara lain mengatakan bahwa ini bukan forum WTO, ini adalah forum G20. Artinya, jika mereka mendukung, mereka harus melakukannya di WTO. Tentu kami memahami bahwa ini bukan forum WTO, tetapi jika mereka memiliki political will, mereka bisa melakukan komitmen di G20 dan terutama di WTO. Mereka juga bisa melakukan sharing teknologi. Kalau mereka tidak mau, mereka bisa mendonasikan vaksin, mereka bisa mendukung pembiayaan. Tetapi yang masih kurang dari G20 adalah mereka hanya menyampaikan di paper saja sebagai komitmen. Tetapi komitmen itu bisa dikatakan itu adalah komitmen kosong karena kemudian tidak ada implementasinya. Mereka mendonasi vaksin tapi tidak cukup, sehingga tadi masih banyak negara-negara yang tidak punya vaksin. Mereka mendukung keuangan tapi masih jauh dari harapan, sehingga negara-negara itu harus lari ke Multilateral Development Bank untuk mendapatkan pinjaman dana supaya mereka bisa membeli vaksin. Mereka juga beberapa negara itu berutang kepada Bank Dunia dan IMF untuk mendapatkan vaksin karena vaksin dari COVAX terlalu lama untuk ditunggu dan donasi juga tidak ada. Demikian Saya kira jadi banyak yang bisa dilakukan oleh G20, tetapi mereka tidak mau melakukannya. Sehingga ini menurut kami mereka tidak punya political will. Saya kira itu dulu. Terima kasih.
Okay, thank you very much, Mbak Hanim. So Mbak Hanim mostly talking about how to reach the vaccine equality, especially through the G20, with the emphasizing on the TRIPS waiver. And we will continue with the second speaker. Is Pak Ronald already joining, Mas Agung? Not yet. So Mbak Hanim, while waiting, I think Indonesian government is supporting this TRIPS waiver as the co-sponsor. Yeah, I think last year. So this is already quite a good step for Indonesia. However, it needs more support, more political will, especially from other G20 countries.
Exactly.
Mm-hmm. All right. Hello, Pak Ronald, are you joining us? Not yet? All right. If Pak Ronald is not joining us yet, then we will continue with the presentation from Angela Tanija from Oxfam India, also representative of People's Vaccine Alliance. And also for all of you who are joining us in Zoom, if you have any comments, questions, or remarks or others, you can write it in Zoom chat. We will also have the direct time for you to speak later after all the resource persons speak. Angela, hello.
So good to
over to you.
Over to you. It's good to have had the overview of the basic statistics of the extent of inequality of during the pandemic, but perhaps there's no harm reiterating just how bad things are. Reality is that the world is seeing extreme vaccine inequality. Reality is that the impact of the pandemic has been extremely unequal both within and across countries. And the reason why things are the way they are is fundamentally a failure of multilateralism and fundamentally a consequence of commercial greed and national self-interest that several countries have and pharma companies have shown. What is it? What does the data show? The data shows that as of now, the COVID deaths are almost 4 times higher in poorer countries than in richer countries. Reality is that while the global north seems to have declared the pandemic almost over, there have been 3 million deaths since Omicron, and let's just accept that the pandemic is not over. There is every probability of the next variant being even more deadly. 4 children a minute have been losing a parent or caregiver to COVID. And 160 million people have been pushed into poverty, and the number is still growing. Why are they where they are? Because vaccination has not happened. And why has it not happened? To a substantial degree, it is because of pharmaceutical monopolies. And as of now, pharma companies have the power to dictate where the vaccine go, at what price, and who gets to buy them. The consequence of that is at a time when the countries across the world have been devastated economically. We're also seeing at least a growth of billionaires, and at least 40 new billionaires have come by profiteering from vaccines, treatments, tests, and PPEs at this point in time. Therefore, pharma sector has maximized profit at every turn, and less than 2% of the global vaccine supply has gone to the poorest countries. Yes, while doing so, big pharma companies like Moderna, Pfizer, BioNTech have together been making almost 4 million an hour in pre-tax profits. An attempt was made to what can be described as a charity model in terms of donations to COVAX. However, it's been only a trickle of supply that has come. And we were promised 2 billion doses by 21. We've delivered less than half. COVAX is now out of money. Yes, rich companies have promised donations, but have delivered less than half. And again, the interest in doing so is also fading. And therefore, there is now discussion around, and last few days of media discussion has been that COVID risks becoming a poor nation's disease. And that's predominantly because vaccines have not been made available. And that's because the vaccine waiver, IP waiver has not materialized, and despite they asked for a people's vaccine. What are we asking for? We're asking for 5 basic things. We're asking for a global roadmap to deliver the WHO goal of fully vaccinating 70% of people by mid-22. Not half the people, but fundamentally one should aim for all people, but let's settle for 70. Maximize the production of safe and effective vaccines and other COVID products by suspending all intellectual property rules for the duration of the pandemic. Yes, it also involves mandatory pooling of all COVID-19 related knowledge to allow the manufacturing of vaccines, treatment, and tests. Thirdly, invest public money in rapidly and increasing vaccine manufacturing in order to ensure manufacturing capacity increases. We have been told, and we have been consistently being told by pharma companies, hey, companies in the global south can't do this. This vaccine manufacturing business is too complicated. But at least 100 companies able to do mRNA technology exist in the global south. They're standing by, lift the IP waiver. There's no shortage of companies that can start manufacturing. And COVID vaccines tests must be sold to government and institutions at a price that's as close to the true cost as possible and provided free to everyone, everywhere, and allocated based on need. And yes, what the pandemic has taught us is the need to have sustainable investment in the public health system, because weak public health systems are the ones that have been most likely to fail. What is it that we want now, especially now that with the Indonesian presidency? It's great to have a G20 president who is a co-sponsor of the waiver, but Indonesia hasn't been as vocal as, say, South Africa. We've been hearing Ramaphosa's voice standing up for up to the EU. It's now President Jokowi's turn, now that he leads the G20, and it would be essential for him to demand to address the limited access to COVID technologies. Indonesia itself has strong vaccine manufacturing capacity. The government has been saying Indonesian companies can make the vaccine, and they definitely can. Therefore, we urge the Indonesian government to do more to showcase its capacity to stand with the leading co-sponsors of the waiver and demand that it is agreed now and for all. And we've been promised that IP rules, waivers would never stand in the way of tackling public health emergencies. We're now 2 years into the pandemic, and we need to waive them now, and we need Indonesia's leadership to achieve this. Thank you.
Thank you very much, Angela, for also emphasizing more on the importance of vaccine equality to end the pandemic, and also how to the urge or the demand to Indonesian government to increase its voice, and also the support, especially for the TRIPS waiver and also others monopoly to against the pharmaceutical firms that already produce tens of billions of dollars, yeah, in this pandemic. This is also a sad reality. Meanwhile, the research and others are mostly funded by public money, but then they make huge profit from the vaccines productions. So now we will continue to our third speakers, which is Miss Lena. Miss Lena will also discuss about the global vaccine access also, and from her perspectives. Hello, Miss Lena. Yes, please.
Yeah. Can you see my screen?
Yes.
Great. So I'm very happy to be here. And I just wanted to say this, that it is actually quite important that Indonesia is now, in some sense, chairing the G20, because some of the issues that low and middle income countries have been putting on the table globally vis-a-vis the pandemic can come forward in the G20 discussions. And this is absolutely crucial as a civil society, that we contribute to the efforts to support Indonesia. So one of the key things I just wanted to highlight is Indonesia played a very important role in the past when it, during the H5N1 in 2004, which was considered to be a very important threat. And there were plans to develop a vaccine, but there was no effort to discuss benefit sharing with low and middle income countries. Indonesia actually, on behalf of developing countries, asked WHO and other actors about benefit sharing. So it's very important to recognize that vaccine access is not a new issue, that vaccine access has been placed by key countries like Indonesia on the table at various fora, including in past anticipated pandemics. In H1N1 in 2009, we already saw an clear emerging inequality, where high-income countries placed large advance orders for the vaccine for H1N1 and bought virtually all the vaccine companies could manufacture. Now, of course, we know that this happened in this pandemic as well. So what we are dealing with is a fundamental problem. Now, if you look at the routine vaccines, if you look at the pneumonia vaccine, very crucial to reduce mortality among children and the elderly, you will see that there was a lack of competition, high prices, monopoly, and majority of ministries of health have not been able to provide children under 5 the pneumonia vaccine. Only a certain percentage of children have been vaccinated. So we know that there's vaccine inequity. It is driven by inequality, high prices, and monopolies. However, this issue needs to be taken forward even beyond this pandemic. So G20 is going to be very crucial for this issue in the future as well. And as civil society, we could play a very important role, but also, of course, the Indonesian government itself will play a very crucial role in these discussions. Then what do we see? We don't just see, so this is just after the Delta wave, and we all know the Delta wave struck our countries in the region very, very hard, starting from India. And I think all of us were completely, we lost, family, friends due to the Delta wave. And we realized that the Delta variant was extremely deadly. And when the Delta wave started in India, the scramble for vaccines really picked up. And what you see is that in August 2021, when the Delta wave was peaking, you can see that, there were 5.6 billion doses produced worldwide, and only 5% of these had gone to low-income countries. India and Indonesia.
Sorry, Lena, yes. Sorry. Can you please make it full screen, your presentations? I think the participants online cannot see it clearly. Sorry.
Okay, no, I'll just do that. Just a second. I'm just struggling with that because of my...
Below here in the... below, yeah, that one. No, the next to it, yes, that one.
Perfect. Great.
Thank you.
I'm sorted on that. Thank you for your help. So if you look at the issue of vaccine inequity, it's not just about vaccine doses themselves. The inequity is driven by manufacturing capacity. Majority of manufacturing capacity has been dominated by big pharmaceutical corporations, and this is predominantly in the north. The other country which has significant manufacturing capacity is India. However, as we know that India during the Delta wave could not export, and therefore many countries in the region and worldwide were hit very, very hard. The lesson that we learned from this is that we need to diversify manufacturing and ensure that regionally we are able to produce the vaccines we need in a public health emergency. So if you look at the ASEAN region, if you look at Southeast Asia region, Malaysia, Thailand, and of course, Indonesia play a very important role in producing vaccines, and of course, in negotiations leading to the issue of technology transfer, benefit sharing, intellectual property waivers, and so on. If you look at the next slide, I'm just struggling to go to the next slide. Strange. Okay, I'm going to continue without my slides if I can. I do not know why it's not moving.
You can minimize it first, I think. Usually, yeah, there's...
Never had this problem before. Oh, yeah.
Yeah.
It's moving, but without my this thing. So if you look at the vaccine supply challenges, is that the TRIPS agreement that all of us are members of, which is relating to intellectual property minimum standards that countries have to implement, and regionally India's had to implement, Indonesia's had to implement. The trade-off was that in lieu of monopolies, in lieu of intellectual property that we would implement, there would be a technology flow to our countries. That has not happened. So the control of global production and supply continues to remain in the hands of a few corporations. They also decide who is going to get a license to produce these vaccines. There is, of course, then a resulting fundamental limited vaccine supply. High-income countries have been accumulating those vaccine doses, and high-income countries refuse to exercise control over technologies that they funded, mRNA being a classic example, and not sharing the technology with low-income countries, and even the WHO hub. If you look at the COVAX facility that some speakers referred to predominantly, their reliance was predominantly on India to supply the countries that were part of COVAX. So that left a lot of countries going out to do bilateral deals with pharmaceutical corporations and having to pay very high prices, or having to deal with the demands of indemnity clauses. As we all know, the indemnity clauses were brutal in undermining our sovereignty in the form of, waiving all requirements of corporations to be accountable to the people who were vaccinated with their products. If you look at the donation situation, donations came too late. They had very short shelf life. They did not meet the recipient country's needs often, and without provision of products like syringes that were required during vaccination. So we can't actually depend on donations alone to deal with health emergencies or even public health, diseases like HIV or TB. If you look at COVID-19 and the new technologies, we've not had any sharing of tech and data in the pandemic. Financial support from governments and public sector R&D has been significant for mRNA. WHO has set up a tech transfer hub, but Moderna and Pfizer do not cooperate by providing the data and the technology, even despite the fact that 120 manufacturers with technical requirements and quality standards to make the mRNA vaccine exist across Asia, Africa, and Latin America. So that includes, for example, Indonesia, South Africa, Brazil, and India, and of course, South Korea. So you got strong potential for use of newer technologies against other diseases and the mRNA, but that technology did not flow as was promised in the TRIPS agreement. So I'm just going to do a quick slide. I know everyone's very concerned about vaccines, but this is a slide on the current drugs available for COVID-19. And I would just like you to see the third drug listed, baricitinib, which is for severe drugs, severe disease. And it's a very affordable drug. It's in generic production. It just costs $7 to $14 a treatment course, but it is heavily patented in countries across the region, including Indonesia. And of course, Eli Lilly, which owns the patent, is charging very high prices from countries like South Africa. And I would not be surprised this is the case for Indonesia. So we can't take away that we will be looking at compulsory licensing in the future for these drugs, whether for this pandemic or the next. And Indonesia, of course, was one of the few countries that did issue a compulsory license. So, putting this on the table of G20, that, making compulsory licensing as routine is very, very important. If you look at the G20 position on the TRIPS waiver, it tells you a very important story. So if you look at it, you've got the United States, who's only supporting the waiver for vaccines. And I would request Indonesia to ensure that, they convince their allies, including other members of the G20, to look at therapeutics as a very important area where a waiver would be required, since Indonesia had to issue a compulsory license. You got majority of countries as supporters, but you also have a few important G20 countries who've been opposing the TRIPS waiver. That includes France, Germany, Japan, and the United Kingdom, and perhaps South Korea as well, not playing a very constructive role. If you look at Indonesia, Indonesia is a co-sponsor. South Africa and India, of course, are sponsors. So I just wanted to sort of highlight that within the G20, there's no unity on issues like the TRIPS waiver, and it would be useful, even if there's no change of position on the TRIPS waiver, to acknowledge the principle of no IP enforcement in a pandemic or an epidemic. And bringing myself to the last slide, based on assessment of G20 countries, I think recommendations for advocacy as C20 would be the following: that we have equitable access for LMICs as a very important principle taken forward in the G20 discussion statements. It's very important that, the high-income countries, there's pressure on high-income countries that there be greater equitable access and to do more about it. Continue support for the TRIPS waiver in different ways. As I said, the principle that there should not be IP barriers in a pandemic is a very important issue, and there should be an expedited solution to IP barriers is a very important issue going forward. The G20 should note that there's a need for technology transfer and development of technology for regional and domestic production and supply. And this needs to be done as a mechanism of preparation, not when the pandemic as its peak and demand is high. So, you can see WHO set up a COVID-19 mRNA hub, and it's slated to set up a biosimilar facility as well. And the last point I wanted to say is this, that we need to reflect these issues in the treaty negotiations, the pandemic treaty negotiations. And G20 will probably play a very important role, as will Indonesia, in the pandemic treaty negotiations, if they happen in the future. So I just wanted to stop here and say that we as civil society, in this region, who are part of G20 countries, have a very important role. And thank you so much to both the Indonesian government who was listening and to civil society.
Thank you, Lina, for your excellent presentations. We have additional or more also abundant information and data about the vaccine inequality, including the details of which country is supporting the TRIPS waiver, which country are against the TRIPS waiver. And also you mentioned about a very important point that this is not the first time we face this vaccine inequality. We also have the H1N1 before, and also we might will have another pandemic in the future. That's why the global health architecture and also how to make the structural reform in our health system is also very fundamental, because this is not the first time, as we even after the H1N1, we still not learn the lesson. Yeah, we still not do the structural changes that we need to ensure the vaccine access for all, and also other access like the medical, therapeutical, and others to ensure that we can end this pandemic soon. Now we already have all the presentations. I'm not sure if Pak Ronald already joining, but it's fine. We will still continue with the discussions. So
I'm already joining.
Okay.
Sorry,
Pak Ronald.
I'm a bit late. Yeah.
Yeah. Okay, Pak Ronald. Please, Pak Ronald is the special staff for the Minister of Health of the Republic of Indonesia. So, Pak Ronald, over to you for your presentation.
Okay. Good morning, and thank you, Lina, for your presentation. I think your presentation is excellent, and also I think it's aligned quite perfectly with our what we want, what we are trying to do now in our presidency in G20 from the health side. Yeah. So next, Alvin. Next. So there are, as I think this one, Lina already mentioned perfectly, on the inequity of the vaccination in the world, where the low income, lower middle income, and high income countries, there are quite differences. Yeah, from what we see, I think there are three stages of cause that result in this graph. Yeah, the first is on the early of the pandemic. In the early on of the pandemic, it's a matter of technology and financing. Yeah, so the high income countries have the technology, have the ecosystem and the infrastructure, and they can come with the so-called vaccine technology faster, yeah, than the low middle income countries and the low income countries. And the second is also on the financing. Yeah, on the financing, they are able to pre-purchase, yeah, with what we call an at-risk funding, yeah, to whoever vaccine producer that progressing in their clinical trial. So they have the financing muscle to actually pre-purchase with the risk of those vaccine will not work. Yeah, those kind of risk is very hardly or practically executed by the low middle income country and the low income countries. Now the second stage is actually in the middle of the pandemic, where the vaccine starts to come in, and then the access to the vaccine is the problem. Yeah, but thankfully we have COVAX that actually in the middle and can try to distribute the vaccine equally, yeah, from the vaccine that they get. Now, in the later stage of the pandemic, like exactly at this point, yeah, Indonesia gets a lot of requests, yeah, from the high income countries, the upper middle income countries, and also COVAX to actually receive the vaccine from COVAX, the donation. Our question is then, why don't they supply it to the low income to the low-income countries, then the problem is not only the supply now. Yeah, now is the capacity to execute. Yeah, so there where very important primary care resiliency needs to be. Yeah. So in low-income countries, lower middle-income countries, the primary care is not strong enough to actually be able to absorb the vaccines. Yeah. That's why you will start to hear some of the vaccine will get expired and etc. And the high-income countries try to supply as much as they can. But now the problem is the demand and the infrastructure to execute the demand. So this is what we will try to address, yeah, in our next presidency. Yeah, the vaccine, the financing, the vaccine technology itself, and also the last one is actually the health system resiliency to actually be able to execute the vaccination. Yeah. So moving from there, we have Indonesia have three priority issues from the health agenda. So if you remember, President will focus on three main agenda. One is on the health agenda. Second is on the digitalization. And the third is on the green energy agenda. Yeah. So on the health agenda, we will try to strengthen global health architecture by focusing on three priority issues. One is on the building of global health system resiliency, harmonizing global health protocol standard, and also expanding global manufacturing and research hub for pandemic prevention, preparedness, and response. Those three priority issues is being separated into 4, 5, 6 main programs. Yeah, one is on the financial resource mobilization. Yeah, so how, just like Lina mentioned just now, how in the very early of pandemic there are a mechanism to be able to mobilize the financial resources, yeah, to tackle the pandemic. The second is on the resource mobilization. So if we already have the money, like in Indonesia, in the early of the pandemic, we have the money, but it's very hard for us to be able to purchase the masks, to purchase the protective suits, yeah. Actually, to purchase anything, yeah, we need to go to China, we need to go to US, ventilators, and etc. We have the money, but we are not able to get the access, yeah, to the medical countermeasures. So that problem to establish a global mechanism for mobilizing essential health resources is also our one of the priority agenda under the priority issues number 1. Yeah. The last one is on the genomic surveillance. Yeah. We optimize the global genomic data sharing. Yeah. One that play a very key role in COVID-19 is GSAID. Yeah, where anytime we understand that there are new strains, the scientists will share it, and then the vaccine manufacturer or the drug manufacturer can adjust, yeah, or also our testing system can be adjusted, yeah, to the new virus or new strain. So these are the first priority issues that being separated into 3 main programs. The second priority issues on the harmonizing global health protocol standard. Yeah, like right now we go to US, different protocol, we go to Europe, different protocol, we go to China, different protocol, right? So we are trying to adjust, yeah, the protocol globally, yeah, so that it can be like passport. Passport, we only need one, and then it is same for every countries. So we are trying to build up one digital system, yeah, that will be able to allow interoperability of programs in each countries. We are using the WHO guidelines, yeah, for the for the recognition of COVID-19 digital certificates at point of entry. The third priority issues is on the expanding global manufacturing and research hub. This is also same to the what Lina just mentioned. Yeah, we want to expand the global vaccination, therapeutics, diagnostic, and manufacturing hubs, not only vaccine. So right now, most of these hubs is actually exist in the northern side of the globe, yeah. But in the southern side of the globe, it's very lack of capacity, yeah. So we thanks also WHO. I think 2 weeks ago they start to create this hub and spoke for mRNA vaccine, and in Indonesia itself, we are trying to invite, yeah, most of the global therapeutics and diagnostic manufacturing to come to Indonesia and make Indonesia as the manufacturing hub, yeah, for the Southeast Asia. Yeah, so for the Southeast Asia, we need to advocate also for the southern of Africa and also for the southern of America. Yeah. Now, to be able to expand, yeah, those manufacturing hubs, we need to strengthen the global network of scientists also. Yeah. So the scientists not centered in US, in Europe, yeah, or in China, but the southern part of the world also needs to be strengthened. So if I use Pak Menteri's, the Ministry of Health's analogy, if you watch War Z, the movie War Z, say the zombies are all in the northern side of the world, you need the scientists on the southern side, yeah, to come up with the countermeasures. Yeah. So if you focus your hubs and your scientists in the northern side, it's very bad for the resiliency of the world's in actually response to the pandemics. Yeah. Next. Now this is just the additional points. Yeah. So right now we already circulate the concept note on those 3 priority agenda to the G20 countries. Yeah. We will need, yeah, we will need to for the C20 team also to advocate, yeah, together, yeah, this health agenda, because this is the first agenda under 3 agenda that the President Jokowi is actually advocate on, yeah, the health agenda. So this is just the additional points, yeah, the additional details, yeah. And also, sorry, I forget to mention that Pak Jokowi in this G20 presidency want really a concrete result, yeah, not only like a communique or the agreement, yeah. We really want something concrete, like agreements or like MOU or whatever that really have a concrete result on our presidencies. Yeah. So in the first and second priority agenda and the program under first priority agenda about the financing and also the countermeasures. Yeah, we are working with Ministry of Finance, World Bank, and also with WHO. Yeah, to come up with the mechanism, Yeah. So that's still in the discussion, and it's progressing. And if you follow G20 under a joint financial and health task force. These are evolving discussion on the facilities and on the mechanism of the countermeasures. So on the facilities itself is still under discussion, and on the mechanism we are trying to discuss on how we can discuss about the act accelerators. So these are the expected outcomes, really concrete expected outcomes that we want from our G20 presidency under priority number 1. I don't think I need to explain all this. Maybe Alvin later on can share with you the details, but it's the same. It's the same. It's the same with what I mentioned just now. Next.
Pak Ronald, sorry, 2 minutes more.
Next.
Tes, hello.
Ya, kedengeran Bu. Next.
Sorry.
Next. Yeah, this on the expected outcomes of the vaccine therapeutic, diagnostic, and vaccine therapeutic and diagnostic tools. What I mentioned about we need to have a hub in the southern part of the world. Next. Next. Yeah, so the role of C20, we really need your support, to advocate also the third agenda that we have right now under our presidency, and also help us, so that we can come up with the concrete result in October when we have the all country meetings in Bali, if I'm not mistaken. So that's all from me. Those are our 3 priorities agenda. We have sent the concept note to all the G20 countries. I need to check whether we can also share to the C20 team, later on, and if yes, it's the right time, then we can also share to C20 team later on. So that's all from me, Bu Tatat. Thank you very much.
Thank you very much, Pak Ronald, for a very comprehensive presentation, especially on the position of the Indonesian government on the global health, the 3 priority issues in the global health, as well as the details of how to deliver it. I think Pak Ronald also mentioned one of the very important point that it's not only the vaccine availability, but also how to ensure the infrastructure for the distribution. This is what we still needs the homework, especially for the low and middle income countries. The vaccine might be available, which is not always the case. That the fact there is still many countries that still cannot have the access to vaccine, but the infrastructure for the distribution is also very important. The storage and others still needs to be ensured. Now we will go to the discussion. There's some corrections. That Lena is actually from the Medecins Sans Frontières. There's some of the mistakes in the organizations that I read before. Sorry, Lina. So I want to correct it. And there are 2 questions, I think, in the chat room. The first one is from Jorge Saavedra. He asked about Jorge is asking about how to deal with the global. I think it's not the question, but it's a comment. Later, maybe all the resource persons can also respond to the comments. And then there are another questions from Muhammad Iqbal Hafizon to Pak Ronald. How can we make sure that G20-driven financial facility will not reducing the central role of the WHO for pandemic PPR? That's the question from online. now, since there are also our friends here offline, I will give, I think, 2 opportunities for our colleagues here to ask directly. If there's 1, 2, okay. Wait, I will give the microphone.
Bu Tatat, I'm really sorry. I need to leave at 10:30, ya Bu. So
Oh,
I
yeah.
will respond to
The question.
to the questions before give it to the floor. Yeah.
Oh, yeah. Okay.
So,
Okay.
So
Okay,
on
Karana,
the
please.
yeah. So on the WHO role, actually, right now the Secretariat of the Financing is being hosted by WHO. So WHO is working together with World Bank and with us and with Italy as the co-chair to come up with the mechanism. So it's still on the evolving process. I'm sure WHO playing a very key role, yeah, on the come up with the mechanism, yeah. So I don't think the worry of undermining WHO's position, yeah, under this if we may say new facility will happen. Yeah. Actually, what we really want right now is to be able to have the facility that can very fast, yeah, very fast being disbursed, yeah, when the pandemic happened, and also a facility to help the low-income countries, yeah, to building up their to strengthen their PPR system in the country during the non-pandemic era. Yeah. So it's also very important because just like I mentioned, when you have the vaccine, but you don't have the nakes, yeah, the what you call in English, the health worker that be able to and don't have the logistics that able to deliver those, you cannot do it anyway. I forget about the second question, Bu Tatat. Can you repeat it?
Yes, Pak. Actually, there are questions in the chat room for you also. Previous experience with avian flu is that countries such Indonesia have shared genomic information, but the problem is that countries that share this information do not get benefit sharing because the problem of data sharing and also how to share the benefits. Can I have my one question from the floor, Pak, for you?
Okay. While waiting for that question, I will answer this one. Yeah. So there are two
if
things.
There's any...
Yeah, there are. I think we split. Yeah, we split the discussion into 2 areas. Yeah, one is on the data sharing itself. Second is on the benefit sharing. So to be honest, we pragmatically separate those two. And under our presidency, we will focus on the data sharing first. Yeah. So on the benefit sharing, there are a long discussion already happens, and we don't want to not involve but directly involved on that part because our presidency is not that long, right? It's only 1 year. So on the benefit sharing, I think the talk is going on. If I'm not mistaken, under TRIPS, under Tokyo Protocol, and etc. So those discussions involving G20 countries also is happening. So we are not go into that benefit sharing discussion. What we are discussing right now, just like Lina just mentioned, is on the data sharing because yes, it's very important. Yeah, and there are platforms that all the scientists in the world are believe in, which is right now one of them is G20, and it works perfectly. If I may say perfectly, during this pandemic, for us to be able to get very fast data. Yeah. So to give you an answer, right now we only advocate for the data sharing mechanism. Yeah, we are not go into benefit sharing because there are already a parallel discussion on the benefit sharing.
Oke, thank you Pak Ronald. Bapak silakan.
Ya, terima kasih Pak Ronald. Mungkin kebetulan karena Pak Ronald sudah menyampaikan konsep note G20, menurut saya konsep note-nya terlalu lemah karena itu terlalu mikro, Pak. Jadi
namanya Pak?
Oh ya, saya Inang Winarso dari Yayasan Kemitraan Indonesia Sehat. Jadi konsep note-nya terlalu mikro, Pak. Jadi kita berharap tadi sudah dijelaskan bahwa ada banyak ketidakadilan antara negara-negara utara dengan selatan. Jadi di dalam konsep note itu saya kira harus memunculkan nilai keadilan apa yang ingin dicapai. Kalau soal yang mikro-mikro, transfer teknologi, kemudian budgeting, saya kira itu akan mengikuti, tetapi nilai keadilannya yang harus disampaikan oleh G20. Jadi saya menyarankan Kementerian Kesehatan membaca basic dokumen 49 milik WHO, bab 2, pasal 2. Ada 22 kewenangan WHO yang harus di restructuring. Artinya kalau bisa dipangkas untuk membuat negara di selatan menerima keadilan yang sama dengan negara-negara di utara. Jadi Kemkes harus merujuk kepada basic dokumen WHO 49 tahun 2020. Ya, Pak? Ya, terima kasih.
Terima kasih Pak Inang. Satu lagi Mbak yang di belakang mungkin singkat ya Pak, karena Pak Ronald sudah mau pergi. Ya, saya usahakan singkat. Saya Rizky saya mewakili RCCE Working Group. Colleagues from who join online. My name is Rizky. I'm representing the Risk Communication and Community Engagement Working Group for COVID Response in Indonesia. Members also include civil society organization, academia, media, journalists, including government institution. So we have 3 points that we want to share here in this forum. First is that I think this one is aligned with the point that was raised by Pa Ronald as well. We advocate for equal access for COVID vaccines, but not only globally, but within the country that already have COVID vaccines or other vaccines. It's very often that some minority group not necessarily have the same access to vaccine, such as people with disability, people who live in remote area. And actually we can see from the dashboard, government dashboard, that the coverage is high in most of the province, urban area. But if you look at some of the remote area like Papua, coverage is still remain low. And we can see for some priority group that have a severe risk for COVID-19 infection, like elderly people, access is also remain low. Second one is actually when we push for better access for vaccine, there's issue with policy within country that may also jeopardize access for vaccine. For example, in Indonesia, we have what we call UU-JPH, Undang-Undang Jaminan Produk Halal, that require all medical vaccines and other medical product.
Mbak, boleh dipercepat, Mbak?
Yes, to have halal certification, and it's clearly also become a challenge for access for vaccine, not only for COVID vaccine, but also vaccine for routine immunization. The last point is on the effort to increase acceptance for vaccines. Even though we have access for vaccines, people not necessarily utilize the services because of the infodemic, because of hoax and misinformation, and it require a lot of effort, including from government, to address this issue. Thank you. Thank you, Mbak Rizky. So, Pak Ronald, maybe your final remarks or final closing, as well as we also very happy that you mentioned the Ministry of Health wants to also work together with the civil society, as our goal is mainly the same, ya Pak. So, your closing statement, Pak, also responding to the questions. Thank you.
Yeah. So. Again, thanks a lot for the inputs. Yeah. So on the concept note, we will definitely hear your inputs. Yeah. On the macro side of things, especially on the equality. The concept note is an evolving document. So going forward, we will definitely hear from you, from your inputs, yeah, to actually perfecting the concept note, yeah. Number two, why it feels micro, yeah, because we really want to achieve something, yeah, by the end of the presidency. That's why we pragmatically choose what are the very important things, the main drivers that can address the macro issues. Let's say about the inequality. Inequality will always happen if the manufacturing hub is not there. So it's very human, yeah, to protect themselves first, their country first, yeah, before helping others. It's very human. So how we address it? Yeah, we address it. One of the ways to address it is to have the equality of manufacturing hub and equality of research hub. Yeah, in the southern side of the globe. Yeah. To be able to do that, we need the funding. To be able to do that, we need a mechanism to be able to quickly mobilize the resources in northern side of the world and resources in the southern side of the world, to be able to quickly mobilize those resources. So that's why we are talking about the mechanism of mobilizing resources. So if you see, as the overall, what we are trying to do is to get the micro things, the drivers that really important things to happen, to be able to address the macro problems. So those are two things that I think we will work on going forward. We will definitely hear and also consider the inputs from the civil society 20, right? And the third, responding to the last question, is that's why the system strengthening is very important. System strengthening is very important because after you have all those, if the health system in your country is not ready, you will get a problem. Yeah, even if we have all this, the medical countermeasures, the vaccine, and etc. So we need to strengthen our primary care system, which also is an important agenda of the Ministry of Health in the next 2 years. We will very focus, yeah, for Indonesia. This is not G20, but for Indonesia, we will be really focused on the primary care strengthening, and most of our budget will goes into primary care. So that's all. I'm really sorry I cannot follow this until the end, Bu Tatat and everyone, because I need to go for other meeting in. It's already happening actually. So thanks a lot for the invites, and we really hope your support, yeah, for our health agenda going forward. Thanks a lot, and thank you very much.
Thank you, Pak Ronald. Sehat selalu. So we will continue the discussions. We already have quite lots of questions in the chat room. I think I will pick the last one first. For all the for Mbak Hanim, Lina, and also Angela. Will Indonesia include the TRIPS waiver terms in its G20's concept note? Oh, it's actually for Pak Ronald, yeah, sorry. Okay, then from Jorge, then who is one to blame for? All right. So from the second question, from the presentation, it is stated that pharmaceutical companies also have their own licensing mechanism to produce vaccines. How many companies are parts of this licensing, and what terms and conditions that companies should fulfill to be a part of this system? What is this system insufficient to produce global vaccine? It is clear that the most presenters support the TRIPS waiver proposal instead. So I think Lina, Angela, and also Mbak Hanim can respond to these questions. So first, I will go to Mbak Hanim. Over to you, Mbak Hanim.
Okay, thank you. Pak Rahmat, thank you for your question. Yeah, for the first question is I think it goes to Pak Ronald. And then the second, yes, you're right that pharmaceutical company, they have their own licensing mechanism to produce vaccine. But the problem is how many are they? And they, the problem is how many the company who share the licensing mechanism. So far, I only know that only AstraZeneca, and they give licensing to Serum Institute of India, and it's only one. And also they have a limitation in terms of the distribution. Mostly so it's only one, mean full licensing. So if we want to cover all of the world, at least for the AstraZeneca, it won't be enough. So that's a licensing, voluntary licensing in terms of vaccine that known. So only one. So it's far more than enough. And also because they have their own contract that undisclosed, so we don't know what's the term and condition. Because they are business to business licensing, mean that it is not open for public and public scrutiny. So we don't know yet what's condition and term that signed between AstraZeneca and Serum Institute. And also because this is really insufficient, so we need other term, other method to produce more vaccine and to locally product in a timely, not only in terms of level of production, but also many local production, not only one or two countries. We need more local production. Thank you.
Thank you, Mbak Hanim, who emphasizing on the importance of local productions. It should be locally produced. Yeah, Angela already raised hand. Angela, you want to respond first? Over to you.
So it's not just one or two companies. There have been compulsory licensing agreements reached in a number of places. Fundamentally, yes, compulsory licensing remains an option. In terms of reaching the company and the two companies reaching an agreement can always happen, and the government can force the company to also share the license. But in reality, it's easier. There are two levels to it. One is if an intellectual property waiver happens globally, this contestation will not need to be done location to location. Secondly, in a number, as was pointed out by the previous speaker, in a fair number of cases, the actual agreement reached has been fairly non-transparent. So therefore, an open, free, universal license is better than a series of small licensing agreements reached by a number of states. It's only common sense. I guess Lina has
Yes.
thoughts on this as well.
Yes, Lena, over to you to respond.
So I just wanted to say this, that I've just put on a chat a briefing document that, sort of analyzes voluntary licenses. And I think it sort of brought the learnings that MSF had over a period of 2 decades on voluntary licensing. Now, the matter of real concern is that if the Indonesian government endorses this mechanism where big pharma's cherry picking whom they're going to give the licensing to, and this is a really major concern. We really need the Indonesian government to be more careful about these bilateral licenses. And I can give an example in the context of Indonesia. You have the Corbevax vaccine, you have a protein subunit vaccine. The first license goes to an Indian producer. The Indian producer takes it to market, does the trials, registers it, and then they subsequently do another one with the Indonesian producer. There is no connection between the Indian producer and the Indonesian producer. So the Indonesian producer is going to replicate the entire process again. So what is the benefit of such a license, where you are going to spend 3 years replicating again the whole mechanism of trials and, developing your data for the regulatory authority? We really need to understand that the bilateral licensing mechanisms don't work. And they are very, very skewed towards Indian producers, and they restrict Indian producers to low and middle income countries and do not allow them to, supply all the countries, but they also do not allow manufacturers from other countries to benefit from these licenses. So Corbevax was an exception. It came too late for the Indonesian manufacturers. And based on that experience of a bilateral license, I feel that the Indonesian government needs to be warned that the voluntary bilateral licensing, non-transparent bilateral voluntary licensing, is a trap being laid for Indonesia. So we should really request them to remove that from the concept paper if it is in the concept paper. I would just, reiterate this very strongly with my colleague from TWN who's on the podium. I hugely respect, TWN. So I just wanted to say this, we need to do some serious hard work on this issue of bilateral licensing. We do not want Indian government or Indonesian government endorsing big pharma's, model of cherry picking who they give the licenses to and restricting access in a large number of countries. Yeah.
Thank you, Lina, for your response. Then I will give opportunities to our colleagues here. Is there any questions from our friends here in the room? Not yet. Okay, if not yet, then if any of you, I think I will just call, for example, Loretta Wong. Yeah, this is the question from Loretta Wong. Indonesia is the G20 president this year, India in 2023, and Brazil in 2024. What is the view of the panelists? Is there any opportunity we can build advocacy strategy on TRIPS waiver, not just in this year, but a longer term advocacy? This is a very important question. So I will give to Mbak Hanim first to respond.
Okay, thank you, Ms. Wong, Loretta Wong. Yes, so far in Indonesia and India is proposed the TRIPS waiver, and also Indonesia also the co-sponsor of the TRIPS waiver. The issue is here is Brazil. Brazil is not a co-sponsor even against the TRIPS waiver. So in terms of the civil society, of course, we work together with the civil society in Brazil, India, and Indonesia because we have been worked together for such a long time. But yeah, the issue is, I think for the long term, of course, we agree to build the longer term advocacy. One of the things is, I think, how to at least Brazil to not stay in the street, because just to make it blocking the TRIPS waiver, even if they don't want to use it, just at least to not against, just keep silent in the WTO. I think for the government of Brazil, But for the civil society, of course, we work with many NGO in the world.
Thank you, Mbak Hanim. Let's go to Angela for the response to this question.
So obviously, yes, it could be a great idea to coordinate for the, again, it's only common sense that coordinated action would be essential.
Thank you, Angela. And Lina, please.
There's no doubt that as C20 we need to coordinate more on issues. Even if we directly don't say TRIPS waiver, we need to get an acknowledgement from G20 countries that IP is a barrier. And that's why I put on the therapeutic example, because they tend to deliberately mix up issues of tech transfer with IP and try to say that this is not an issue. So I just wanted to say this, that just getting an acknowledgement from G20 that IP is an issue in creating access barriers is absolutely crucial in terms of coordination. Yeah. And I think in that sense, Brazil, India, and many of the civil societies across the region would be allied to this. G20 civil society would be allied to working together on this.
Thank you, Lina. Now I want to go to the online participants. Oh, okay. Yeah, offline participants first. Silakan, Mas. Mic-nya, Mas.
Oke, thank you Lina for the presentation. Saya mau tanya dalam bahasa Indonesia ya. Dalam presentasi Lina tadi menyatakan bahwa salah satu yang menjadi penting adalah mendistribusi produksi vaksin itu sendiri gitu, agar tidak terpusat pada negara-negara tertentu. Nah, satu minggu yang lalu kita mendengar bahwa Indonesia itu
Mas, nama dan organisasi.
Okay. Nama saya Aditya Wardana dari IAC. Satu minggu yang lalu kita mendengar bahwa WHO menyetujui Indonesia menjadi salah satu yang akan dibangun kapasitasnya untuk menjadi distribution hub. Nah, menurut Lina, kira-kira apa nih yang dibutuhkan, harus dilakukan oleh pemerintah Indonesia guna memastikan bahwa Indonesia benar-benar bisa menjadi hub bagi produksi vaksin di regional paling tidak. Itu yang pertama. Lalu yang kedua, sebenarnya ini buat Pak Ronald sih, tadi karena Pak Ronald sudah nggak ada, mungkin ini bisa jadi bahan diskusi buat kita. Saya tertarik itu mengeksplorasi bagaimana sih sebenarnya strategi pemerintah terkait untuk menjangkau atau mendeliver vaksin kepada last mile population. Konteksnya adalah terhadap aging population atau misalnya orang-orang yang bermasalah dengan ID card, karena kita tahu vaksin di Indonesia itu salah satu kriteria utamanya adalah yang memiliki ID card. Itu yang kedua. Lalu yang ketiga, ini kembali lagi buat Kementerian Kesehatan sebenarnya. Bisa nggak ya kita mempunyai a better strategic information gitu, yang bisa showing disparity between the district, lalu rural and village, lalu across age and gender. Selama ini kan kalau yang selalu ditampilkan adalah, vaksin pertama sekian, vaksin kedua sekian. Itu tidak menggambarkan realitanya. Kita nggak bisa kemudian mendapatkan gambaran di kelompok mana sih sebenarnya yang masih left behind untuk kemudian merumuskan strategi. Apakah kemudian strategic information seperti ini bisa kita bangun dan menjadi salah satu kewajiban lah, artinya buat kita semua di G20 juga untuk bisa showing data itu. Jadi tidak rely pada data nasional aja gitu. Itu aja sih, terima kasih.
Terima kasih Mas Aditya dari IAC. Now I want to give the opportunity to Miss Sineha in the online participants. I think you have many questions in the chat, but you can speak directly also. Miss Sineha, are you still there?
Yes, I am here, but my questions were actually directed to Bapak Ronald, and knowing that he has left, but I will still ask the question here. I think some of them are overlapping a little bit with some of the questions that were already previously asked, so I will just skip that one. So the question I had was, so Indonesia is proposing this new financial mechanism, which is not the first time that we are hearing in the global discussions, and in this, I'm just very curious to know what this financial mechanism would look like and what would be the role of the private sector, of the financial institutes, especially the multinational banks, in this mechanism, and also what would be some role that CSOs could play also in this financial mechanism. And another question that I think was already previously asked was how this new financial mechanism would work with the existing architectures like the WHO without putting in conflict. Also, I did read from some documents that this mechanism is not supposed to replace WHO, but be the financing body. However, when you go into the details, when you have a separate funding entity with a separate implementing body, you know, things can be very difficult. So I was also kind of wondering what this new financial mechanism proposed at the G20 would look like. The other question I had was recently I read that Indonesia will be receiving a tech transfer of mRNA vaccines from the WHO South Africa mRNA hub. And with this, Indonesia is willing to provide vaccines for the region, which I think is a great initiative by the Indonesian government. But I think it would be really interesting to know what this provision, what this support would look like, whether it would be through a bilateral cooperation or through multinational bodies, such as maybe in this region would be like bodies like ASEAN, where I understand the health coordination in terms of like direct implementation is limited, or would it be through a global entity? So those were my two questions that I originally had for Bapak Ronald, but he left. But then I would be happy to hear from anyone else about what you think should be and what's and if you know anything about what would be coming up. Thank you.
Thank you, Ms. Ine. Now we will go to the resource person. Since this is only 8 minutes to 12, I would like to ask all the resource persons to respond to those two questions from Mas Aditya and also from Ms. Ine. And also, please, your closing statement. Now, yes, Lina, please. Over to you first.
Yeah, I'm very happy to have seen Aditya on this consultation. We are all old allies from the HIV movement. I just wanted to very quickly say that, you know, this is a really good moment for Indonesia to have, you know, working on the mRNA hub and receiving technology, because the mRNA technology could be beneficial for a number of infectious diseases. But the Indonesian government would possibly also need to put in its own investments like the Indian government has. The Indian government has been heavily subsidizing the development of mRNA technology from its industry. So you have the WHO mRNA hub potentially working with your manufacturers and a hub in Indonesia, but you also need direct investments from the Indonesian governments to ensure that there's a greater subsidization of the development of the technology, particularly the raw materials and where those will come from. And I'm going to stop here. And I just wanted to simply say this, that as civil society, we need to also not only work on vaccine equity, but also therapeutics equity. Sorry, I'm a treatment activist, so I have to say this. So I'm going to stop here to allow others to, you know, comment. On the financial institution that Indonesia, is trying to build, I think it will be useful to have a very good discussion among all of us that, you know, what has Indonesia put on its table, and have a few experts break it down for us. What does it mean? What kind of money would come in? Where would it come from? What it would mean for support of WHO and so on. So just, you know, Indonesia is such a leader, provides such a leadership in the ASEAN region that we can't afford to ignore Indonesia's proposal. Yeah, thanks.
Thank you, Lina, for your closing statement. Now we will go to Angela.
It's time to have action to ensure vaccine equity, and I'll kind of end with a shameless plug for the PVA People Vaccine Alliance mobilization, which is taking place on 11th of March. Lance has put the link to some of these materials in the chat box. Request everyone to join, because it's through collective action and collective mobilization that change would happen. And as I keep saying, there is no other option other than us coming together to support this.
Thank you, Angela. So yeah, working together, collaborate is the key, Angela. So we'll go to the last resource person, Mbak Hanim, for your response as well as the closing statement, please.
Thank you for the all question and comment. And we are sorry to maybe not answer all the question and also give all comment that comment from your question. So maybe only a few of them that in terms of the COVAX, for example, MSF already sent the document. It's a long document to analyze why the COVAX is failed. Since the beginning in 2020, the civil society already criticized the COVAX or ICT accelerator because the design is not really fit the situation. It won't address the real problem in terms of the equality to access all vaccine and also medicine and other things. For example, like one of the organization involved in the COVAX, like CEPI. CEPI is established during the Ebola crisis, and they didn't fulfill the promise. So then CEPI also involved in the COVAX alliance. So yeah, since the beginning they plan to fail. I mean, they don't plan properly in terms of the governance, and they also do not address like IPR issue as a problem in access. And I think for the C20 itself. For the C20 itself, I think we need to address many issues or give a response what government proposal in terms of health issue and joint initiative between the finance and the health issues. So I think Pak Ronald already give some information about the status of the G20 government position, even though it is still brief, but we can respond from that information. And we need as a C20 we can we can collaborate together in terms of response the G20 present G20 statement and position. Yeah, I think so. The key is collaboration and discussion advocacy within ourselves.
Thank you, Mbak Hanim. So this is just the start. Yeah, we still have like 8 months to go on the C20 advocacy to work together and collaborate together. Now I will go to Rachel Ong. Rachel Ong is our co-coordinator for the Vaccine Access and Global Health Working Group of C20 2022. Rachel will give the closing statement as the co-coordinator of the working group. Rachel, over to you.
Thank you so much, and thank you all for being with us for the last hour and a half, 2 hours and a half. I've lost track of time. Apologies, I'm not switching on my camera. It's been a really busy morning. But I've been asked to provide some closing remarks in reference to some of the work from the Italian C20 Health Working Group last year. So one of the key issues that we've always been advocating on is that intellectual property rights and know-how do not adversely impact the right to health. And that has been very, very telling in this very rich and fruitful discussion from all the resource people and people at in the room right now. I My name is Rachel Ong, and I'm the Regional Coordinator for Global Fund Advocates Network Asia Pacific based in Singapore. I just want to draw and thank Lena so much for her presentation, for emphasizing the fact that in a way nuancing that COVID-19 does not happen in a silo, and that the equity and equality in accessing vaccines is not just an issue faced by COVID-19, and that one of the things that has been mentioned by one of our resource persons is the fact that someone is being impacted and is dying from COVID-19 related opportunistic infections. But in reality, for malaria, every single minute as we are talking right now, a child is dying or is dead from malaria. So there are many other issues that we need to make sure when we discuss health, when we discuss TRIPS waivers, that we use this as a huge opportunity to go beyond just COVID-19 and to make sure that we bring the prices down for all the medications, the diagnostics, the commodities, the treatment that's related to all diseases, so that we are able to achieve universal health coverage. We have in the last C20, not only in the health working group, but also in the anti-corruption group, actually really advocated for ensuring that G20 leaders fulfill their commitments. And in relation to this, there is a strong call around the financing of pandemic responses to ensure that as we are addressing COVID-19 treatments, manufacturing of vaccinations, that we do not bring countries into more debt. So that is a very strong issue that we hope we can carry on into discussions this time. I think that it's important also, and thank you, Aditya, for raising this issue, because I think it is really important to ensure that we have more manufacturing of vaccinations for pandemic responses in the global south. But one of the issues that is really core and central to civil society and communities is who at the end will have access to these manufactured vaccines. We know that laws and legal barriers and social norms actually create a lot of barriers for a lot of key vulnerable and high-risk groups in accessing vaccinations. So while we are advocating for increasing manufacturing, we must also ensure that there are the systems in place to ensure that the communities actually do have access to these vaccinations. So I think I want to, on behalf of all the co-organizers and the co-facilitators, thank you so much for your valuable time, and we look very much forward to actually meeting together as the first in the first meeting for the working group in the coming weeks, noting that this is just the beginning of our conversations in the health working group, but that acknowledging that there are many other prioritized issues that we need to actually urgently also discuss and have underway going forward. So thank you so much for your time, and good morning, good afternoon, and good night for many of you. Thank you.
Thank you, Rachel, for your statements, for your closing statements. So now we come to an end of today's discussion. So I think this is a very fruitful discussion. So we have some, we introduced to each other, and also we have some of the similarities in our advocacy priorities, also some of in line with the government of Indonesia's priorities also. So we hope that we can, as Rachel also stated, we will work together, and also we will meet in coming weeks as the health working group, vaccine access and global health working groups. Thank you all for your time, online and also offline participants. And also, I want to say today is the International Women's Day. I hope we don't forget this also. This is the tagline from the International Women's Day, which is gender equality today for a sustainable tomorrow. As gender, this is also very important. So I would say congratulations for our International Women's Day. To close this discussions. Thank you very much. Yeah, break the bias. Very right, Vanari. Thank you for reminding me about the slogan. break the bias. Happy International Women's Day, and let's work together for coming activities. Thank you. Thank you and bye, stay healthy. Terima kasih Bapak Ibu yang telah hadir di ruangan dan juga untuk yang online. Terima kasih. Assalamualaikum warahmatullahi wabarakatuh.